This city never sleeps. I hear the people walk by when it's late.
Hey guys, it's a beautiful day to make health smart decisions. This is Nazvi, your host here with Health Education Series. Today is about self-care management of diabetes mellitus. So diabetes mellitus, like we earlier discussed, is a metabolic disorder that centers around consistently high blood glucose level. Now, after you have been diagnosed with diabetes, what next? A whole lot can be done at home that will be healthy practices to help you keep up to a good health status. This ranges from consistently monitoring your blood glucose level to exercises to a healthy diet plan. Now, this video promises to explain how best to treat diabetes at home, including the exercises, self-care management, and lots more. Stay connected with me on this episode of Health Education Series. And don't forget to watch the video on diabetes where I explained what diabetes is. It is worrisome to eat food that does not have glucose, no carbohydrate meals because you're diabetic. But in the long run, it is beneficial to your health. So please, when you advise on what to take to diabetic patients, stick to it. It's for your benefit. It is your responsibility to maintain a healthy status after you've been diagnosed with diabetes. Now, these are the things you could do to help you keep up. One is exercise. Remember that obesity is one leading risk factor for development of diabetes. This is because it usually results in insulin insensitivity. So for you to keep up, you have to lose weight. Secondly, is monitoring of your glucose level. That should not be joked with. Consistently monitor your blood glucose level so your physician will know if there is going to be an adjustment in your therapy, or there has to be an increase in the dosage or reduction in the dosage. This is also to see if the medications are eliciting their therapeutic effects. Pharmacological management based on the type of diabetes. For type 1, insulin is administered so it regulates the blood glucose level. For type 2, which is non-insulin dependent, hypoglycemic agents are administered to regulate the blood glucose level. Nutritional management of diabetes. Now, in treatment of diabetes, carbohydrate meals are not completely eliminated. They are only regulated. So if you monitor your glucose level, you can also at one point include a carbohydrate meal when it is normal or when it is low. Now, this is where self-care management comes in, because with the condition diabetes, one is prone to infection, and then one of the complications of diabetes is what is called diabetic neuropathy, where there's a loss of sensation of pain to the extremities, especially the legs. So it is advisable to avoid any form of injuries at all to the extremities. One has to be careful, because you will not even feel the pain when you get injured. Hence, you have to wear not quite tight shoes. Secondly, every morning you place your feet against the mirror or get someone to help you to check between your toes if you have an injury. Also, lubricate between the toes, because when there's friction, there can be wearing and tearing, so you can get injured between your toes. You can wear stockings and never walk barefooted. Accidents are not planned, so you never can tell when you'll be injured. Don't walk barefooted. So food a diabetic patient can eat include proteinous food like beans, leguminous food, food high in fiber, fruits, vegetables, fruits that does not have so much sugar, the likes of apple, bananas, pineapples, cucumbers, watermelon, garden eggs are the best option. You can do smoothie. That should also help. Finally, keep up with your clinic days. This is because your doctor would want to monitor you on if there's a progress, if you're improving in the condition, if there has to be an adjustment in your plan, whether your diet or your drugs. Visiting your doctor on the appointment date is very, very important. Do not keep your clinic dates. I'm sure you had a good time on this episode of Health Education series. Share the video with your friends and family, and don't forget to subscribe. I'm always saying this, it is absolutely free. Thank you so much for having to join me on this episode. I'll see you in my next episode.